everyone. This is Dr. Hurley, and this is Megan, our wonderful office manager. Most of you have seen her around the office. Today I wanted to talk about Sorolla SI belt. This is a product that I recommend to a lot of people. I pretty much recommend it to every pregnant patient, but I also recommend it to my patients that have hypermobile joints, especially hypermobile joints of the pelvis. So this joint in the pelvis is called your SI joint. Back here, that's between your sacrum and your ilium, so that's the SI. And when we lay you down on the table and check your leg length, we are looking to see if that SI joint is rotated. However, with some of my patients, I notice that no matter how many times I adjust that same area of the pelvis, it always is just right back out again the next time. They're not holding that adjustment well, and so I kind of know that pelvis is unstable. So for those patients, I recommend the SI belt. The purpose of the SI belt is to stabilize the pelvis, helps to bring the joints closer together, and to let those ligaments heal and not continue to be overstretched. So Megan is going to help us demonstrate how to wear the SI belt and how it helps. So anybody out there, you have a lot of SI pain, low back pain, maybe you get very temporary relief with adjustments or massage, but right away again you're feeling that same SI pain. Highly recommend the SI belt. And I'm going to show you how to use it because it is a little bit different than you might imagine. So our cameraman might want to come around and zoom in a little bit. Megan's going to turn around for us here all the way. So first we find the seam of the back of the belt here, and we put it right at the center of her sacrum. And Megan is going to strap those two straps in front. Turn around again for the camera. And you're going to do it super low, even lower than that actually, Megan. We're going to do it right at the top of the pubic bone. So that's the number one thing that people are doing incorrectly when putting on those support belts. A lot of people are using pregnancy belts or even lumbar belts. They're using them really high, and so when you're using them that high and you're doing it over the abdominal muscles, you're shutting down the core muscles and you're not allowing them to work properly. So we're actually inhibiting those muscles and keeping them from getting stronger. That's what I don't recommend. I don't really recommend a lot of pregnancy support belts to support the belly, and I don't necessarily recommend lumbar support belts for most people. The reason I like the SI belt is because it's worn very low, and I'm actually going to have you even bring it a little bit lower. So you're going to find your pubic bone and bring it all the way down in the front. So it'll be higher in the front, lower in the back for you, Megan. Okay, good. And I'm going to bring it up in the back a little bit. And then turn again for us to show everybody. We're going to unstrap these, and this is how you tighten it up. So you pull it tight, there. So do you feel supported? Yes. Yes, feel very supported, perfect. Thank you. So these SI belts, we don't have them in the office here. I just tell everyone to go to Sorolla.net, S-E-R-O-L-A, Sorolla, to get these belts. They also have a lot of educational materials on there to learn more about the pelvis, the SI joint, and biomechanics of the spine. So anybody has a question, let me know, and have a great day.